years of research have helped to alert us to that use of marijuana in particular is a very dangerous risk for the mental health of our young people. You have in your press packet a recent summary of some of the research on use and mental health problems in the United States. Let me point to just one set of numbers in that package. The base rate of mental illness, serious mental illness estimated in the country of those citizens above 18 is a little over between 8 and 9%. For those who have used marijuana in their life, that increases to 12.5%. And for those who have used marijuana prior to age 12, the rate of mental illness jumps to 21%. That is 1 in 5. When your child begins using marijuana at a younger age, which is what happens in the United States, it's not the days of the baby boomers of 18 and 19. It's 13, 12, 11, and 10. The risks go up dramatically as both the potency and the effect of this drug on younger brains is now better understood. We're trying to put that information in the hands of more parents and more young people. I want to thank the media for being here because you are the conveyors of information to the public. We are appreciative also of the media's cooperation in our campaign in the effort to allow us to get this information into the hands of more Americans. We'll now be happy to take questions.
Some of us have covered these steroid hearings up on the Hill, too, where it's making its way down to the high school and junior high level for kids hoping to improve their body tone or whatever. They don't feel vulnerable to this stuff, even when you hit them square in the head with it being dangerous. How can you hope to do that with today's message?
Well, I think we have to educate young people. Again, they're young, they're healthy, and so they don't think about their susceptibility to illness and to other problems that these risks involve. Our job as adults is to convey that to them. You know, young people are not born educated. Civilization depends on passing knowledge from one generation to the other. And I think what we're seeing is the hearings themselves, the efforts by the news media to write articles, not only for adult publications, but to make these available in the wider media for young people, but also for us to convey this to teachers and parents and urge them to sit down and focus on conveying this information. Because yes, the view of people who are healthy and energetic and lively is, I'm not at risk. And that's why they get in a car when they're high. That's why they get in a car with a driver who is high. That's why they get themselves into trouble and don't realize it until it's too late in many cases. And that's why in this case, also society is telling them in this case, unlike heroin or methamphetamine or cocaine, that marijuana is not a serious risk. That is deadly. And it is compromising not only the young people who may be involved in accidents, but now we see increasingly that it affects their risk of mental illness, their risk of addiction. Again, we are seeing larger numbers of teens who are seeking treatment for marijuana in the United States than for all other illegal drugs combined. It's corresponded with, over the last 10 years, a doubling of potency, but also, more importantly, to recognize, don't wait till your child gets a driver's license to be worried about them using marijuana. The age of first use is below the age of 16 in the United States. In many communities that I visit, where communities are working, it's down below teens. It's 12, 11, and 10. That's a message we have to reverse, that it's safe, and it's a message about vigilance we need to convey to more people who work with young people.
Dr. Walsh, as a treatment provider in New York City, one of the issues that I know you've taken on that we see still to this day has to do with parents, and parents who've used marijuana themselves. And we often get asked, well, how do you help those parents communicate to the teen not to use when they themselves have used? And I know the partnership came out with some messages on that. I'm wondering where you stand now of how to move that issue forward, helping parents understand even though they use themselves, they can still take a message to their kids that using is not something you should be doing.
Yeah, I think it's a very important point, and I think it is seen as, for many parents, as a hindrance. What do I do about the fact that I've done this before in my life? I think there are two fundamental answers to that question. One, your job is to be the parent. Your job is to protect your children from the risks and not have them repeat every risk and every source of damage that you and young people like you faced when you were growing up. And I think it's very important to emphasize that we have to also not live in the past. Today's teens are exposed to a different level of potency in marijuana. As I said, they are exposed to it at younger ages. And in addition, I think it's also important to recognize that, it's not about, if I did something, I never could talk about it. Some of the most eloquent speakers I see about substance abuse are those who are in recovery, people who have been addicted and who have the credibility to say, look, and I think adults that are baby boomers my age or somewhat younger can say, look, we lost many people growing up. We lost people to overdoses. We lost people who lost years of their lives. We lost people who lost the ability to complete their education, who lost their ability to maintain a healthy relationship with their family. We now see that more probably were involved with the same phenomena we've now studied and have more knowledge of developing and exacerbating mental illness problems. It's time to use that so that we don't have as many people that are sick. Whether you choose to be disclosive of all your activities as a youth to your child, that's your business. I generally recommend that you don't treat your child as a confessor. You're the parent, they're the child. And it's very important to understand also, though, that in addition to what we tell them, that the information you heard here, you need to follow up on their activities. You need to know where they are. You need to know who they're with. We have to watch them. You cannot assume that the world is a benign place because they're no longer toddlers or they're no longer elementary school children. It's a place where they require your guidance, and there are considerable risks, and those risks are exacerbated by messages in society that say these are fun, everybody's done it, it's not dangerous. You have to understand the education they're going to get if you don't talk is do it. And everybody does it, and if you're against it, there's something wrong with you. You have to not think this is a blank slate. You have to erase the dangerous information they get and put in I think the knowledge that we now have that is of greater urgency, and that's why we're here.
Thanks. Today is prevention. The last week, members of Congress on the Hill were complaining that the president's budget reduces prevention money for next year. What is the answer?
What we have sought to do with our effort is to reestablish balance in drug control, supply, treatment, and prevention. We do that through effective programs. We are seeking to maintain programs like the media campaign, which this is a part of, these open letters, our efforts to work with community coalitions, our efforts to use national programs to strengthen prevention in educational settings as well as in medical and healthcare settings. All those programs we are expanding. What we have proposed to reduce is the expenditure for a portion of the Education Department's program funding some efforts in schools. Why? Because those funds have not been shown to be effective. Spending money on programs that are not effective does not help people. It wastes money and it creates cynicism. What we are funding are programs that make a difference, and we try to fix programs that are broken when they're not working, and to use programs that are working more effectively. I think we have to, look, this is a game in Washington. You put a name on something, and you say if you care about that, you spend taxpayer money on it. It's an old game, and we all know that it trivializes this real important work here. The important thing is to spend money on what works, and the good news is drug use in the United States by teens is going down. The President's goal of a 2-year 10% reduction was exceeded. We're now 3 years into that process. There's a 17% decline in teenage drug use. That's good. 18% in marijuana alone. That's even more important. We need to follow through. And I think we're doing that with a constellation of programs that we think work, and we're going to continue to work with Congress to try to fund the things that work and try to use monies as effectively as possible.
Could you tell me, statistically what is the split between sort of the chicken and egg? Statistically, how many of the kids under 12 who are using marijuana do you believe already had mental health problems, and how many do you believe, percentage-wise, are caused by their marijuana use?
I'll let one of the medical experts here talk about that, the extent to which we know that split.
Well, I can give you a precise figure on that. The indications are, however, that as the level of marijuana use is going up, so too is it increasing the risk of mental health problems. So I can't quote you one figure because there isn't one figure. It varies by the age at which the marijuana use is starting, and it varies by the amount of marijuana use that's being used, and it varies by other vulnerability factors that may be in the young person's life. But unquestionably, as their marijuana consumption is going up, it is going up appreciably. A recent study in the Netherlands, which is cited by many people as a country which has a very, very liberal drug policy, has estimated that as much as 50% possibly of adult psychosis cases may be derivable from the marijuana use that's occurred in their youth.
Why would that be? Is there a chemical? Is it part of the THC or something?
Well, that too is an area which research is now having to explore. Up until fairly recently, we have not had good information on the biology of what is placing these young people at such great risk. There has been research carried out which has imaged the brains of young people using marijuana, and that has shown some of the activity which is associated with marijuana consumption. But it hasn't adequately explained why it is that some young people go on to develop serious mental health problems and others do not. There is recent research which is, I'm a bit careful about publicising it because it's not yet peer-reviewed, or at least it's not yet out for publication. But it looks like there may be a genetic explanation in some cases. And I think that, research is extraordinarily helpful here. But we shouldn't kid ourselves that it already has all the answers. There are many aspects of marijuana use which we don't yet fully understand. But the clear message that has come out from the most recent studies in New Zealand, the most recent studies in the Netherlands, the most recent studies in Australia, is that the marijuana consumption is itself causing a level of mental health problems. And that, I think, is the really important message to convey to parents. Because they too, every family in the United States, and indeed every family needs to have access to this information from the most recent research. And it is that research which I think is giving many people cause for concern that the drug that they formerly took to be a recreational substance of no great concern may actually be having serious adverse impact. Now, one of the things that's often pointed out, well, if marijuana is having that impact, why are we not seeing so many more cases of adolescent mental health problems? I can't quote you the statistics here, but in the UK we are seeing a massive increase in young people coming forward with mental health problems in receipt now of powerful medication in relation to mental health problems. Now, we don't know what element of that is being caused by the cannabis, the marijuana use, but it is likely that a proportion of that reflects the level of consumption of that drug amongst young people in our country.
Can we address the issue of causality more closely? Because I think some of the questions here, and I have the same questions, what are the data that point you towards causality? I mean, the association between drug use and mental illness has been known for a long, long time.
Yes.
No one suggests that drug use is healthy. However,
let me take that question.
However, the truth is that many people who eat tomatoes go on to develop mental illness.
Yes.
Not suggesting that marijuana is healthy like tomatoes are, but causality is a far different thing from association. Let's get to those statistics
causality,
specifically.
you're absolutely right. Causality is an extraordinarily important concept here, and one which is difficult to get clear understanding of.
The truth is you don't know.
No. Let me answer the question you've put. The key study here is a study carried out in New Zealand, for example. Now, that study has interviewed young people right from the earliest age through into their mid-20s. What has happened in that study is that people have collected detailed information on their drug use, when it's occurring, how much is occurring, over what period it's occurring, but also any evidence of mental health problems prior to the use of these substances. Now, that study has shown now, it has come out within the last couple of years, persuasively, that there are young people who have had no mental health problems, subclinical or clinical, prior to their marijuana use, who following their marijuana use have gone on to experience serious adverse mental health problems. Now, that is persuasive evidence that it is the marijuana consumption, not pre-existing mental health problems, which is causing the mental health problems subsequently. Now, you're absolutely right that what we need to know is what is the physical mechanism within the brain that is actually causing that to occur. But if we wait until we understand that mechanism, we will have watched many, many thousands of young people go on to experience serious adverse outcomes and in some cases tragic outcomes. So the important public health message has to come out prior to that, the examination of the genetic or biological mechanisms that is increasing young people's vulnerability. It's important to get that public health message out. But you're absolutely right. We still don't know enough about what it is that's the mechanism of this increased vulnerability.
Even the New Zealand study that you just described, though, while it's highly suggestive that there's a close link between drug use and later mental illness, at least based on your description, doesn't seem to prove causality, because someone who's destined for mental illness, if you will also be more likely to use in earlier life. There's also a latency issue where just because they used early and developed later doesn't mean that one caused the other. Of course.
You're absolutely right. The research will never, absolutely, unambiguously, categorically tell you what is actually going on. What you have to do is look at the balance of what the research, the evidence is saying at any time, and say, on the basis of probability, does it look likely, given the nature of these studies that have been carried out, the twin studies, the longitudinal studies following young people over a long period of time, the evidence collectively is suggestive that there is now a causal function associated with marijuana use. Now, if you say, well, I'm not going to accept that, and people still accept that in relation to tobacco and lung cancer, there are still people who will say, no matter the body of research evidence that has shown a strong causal link between smoking and lung cancer, I'm not going to accept that, and I'm still going to smoke. And I think that you're never going to get a situation where research categorically tells you what to do. These are judgments which everyone in this room, everyone outside this room has to make, but has to make hopefully on the basis of a clearer understanding of what the research is persuasively showing. And that research in this instance is persuasively showing that there are serious mental health consequences for those young people smoking marijuana. Now, it will not be the case for everybody, but it will be the case for a significant minority of those individuals, and we don't know who it is going to experience these mental health problems. If we knew that, we could reassure the others who are not going to experience these mental health problems and concentrate on those who are going to experience these mental health problems. But we do not have that clarity of understanding as yet. And as a result, it's important that everybody understands the increased vulnerability to serious mental health problems associated with marijuana consumption. And then on the basis of that makes their judgment. Do they accept the research? Do they accept the counsel of other people? Or are they going to carry on and use anyway?
Let me just try to say from the point of view of those of us who are responsible for policy. What we're trying to do here is to tell you that there are associations of greater risk that we need to bring people's attention to, not unlike the early warning Surgeon Generals gave about cigarette smoking and cancer, asbestos and cancer, cholesterol and heart disease. There's an association, even though the precise mechanism by which these risks are translated into illness are not entirely or fully understood. What we have in these studies, there's a summary of all the different studies from around the world comparing young people longitudinally, comparing identical twins and the difference in risk based on difference exposure, and places that are not in one geographic location but are around the world, that come to the conclusion that the old view that whatever mental health problems may be associated with drug use are a result of the underlying mental health problem and not the drug use. There certainly are people who self-medicate, and that is certainly going to be a part of the problem. The danger that we're talking about here is the growing evidence that the use itself in individuals prior to any symptoms may be triggering and maybe worsening, and certainly looks like it's increasing the risk of the onset of mental health problems. Now, would some of those people have mental health problems anyway, and this may be triggering it earlier, making it worse? That's entirely possible. But it's also entirely possible, and that's what we're trying to emphasize here, that some of those people may not subsequently show these mental health problems. And the evidence suggests, although it's not entirely fixed in its causal, that the use of marijuana at a young age may trigger the onset of problems that would not otherwise be there. Again, this is a warning. If you think marijuana is safe, if you don't understand this dimension of the risk, you need to learn what the science is now showing, and that's what we're here to try to help.
If I could just ask one question. Why did these studies decide to focus on marijuana? Why did it not focus on heroin, cocaine, or alcohol, or all drugs? Why specifically was marijuana chosen?
Well, maybe a misunderstanding. The universe of research done on all substances, tobacco, alcohol, other drugs, cocaine, heroin, methamphetamine, is vast.
Right.
The National Institute of Drug Abuse spends over $1 billion on research. Most of it goes into other drugs. We study a whole array of things. What we've pulled together here and internationally is the research on marijuana, which I think, as was noted earlier, has in fact been a subject of less study. I think partly because of the urgency that many funders have put on, the threat of cocaine or crack, or the threat of methamphetamine, or the threat of heroin, and the tendency, I think, even among professionals, as I think also was noted, to underappreciate the dangers of marijuana. We have a cultural message. Marijuana is not a serious threat. We convey that to our children. That message is wrong, dangerously wrong.
I was wondering, do any of the people on the panel believe that there are legitimate medicinal uses for marijuana, perhaps among adults, not among the is across the board, is there a universal agreement that marijuana is bad and has no redeeming value? Is there anything you think it does have a place in heaven?
Well, let me say, for the purposes of my office and government policy is here. There are components of marijuana that are available for medical use and experimentation. The federal government funds some of that experimentation and research. There is a synthetic form of marijuana that is available by prescription. Smoked marijuana has not been demonstrated to be a safe and efficacious medicine. I know there are people who claim that people who have suffered, smoked it, felt better. I will point out that the reason we have problems with substance of abuse is that people use them and feel better. That doesn't make them medicines. You would feel better if you took meth. You would feel better if you took crack. You would feel better if you took heroin. There's a difference between medical practice and intoxication. So the basic issue here, and there are research, and again, there may be elements, I think, of the cannabis plant that may be demonstrated to be of future use. And in fact, as I said, the United States government is supporting some of the research to look into those. We want the medicines that are revolutionizing our ability to make our citizens and our fellow human beings live longer, healthier, and with less illness. But, let's face it. The people who are putting out ballot initiatives are not based on science. They're based on the view that the society would be better if we legalized drugs. That is wrong, that is dangerous, and that is counterproductive.
Can I follow on that a little bit? Because Canada last week just approved the Sativex, which is an oral spray for the symptoms of multiple sclerosis. Do you find your message here is undercut at all by those hoping to rationalize by saying, well, gee, there's this great medical benefit, we just don't know the extent of it yet?
No, nor do I think that the danger of heroin abuse is undermined because we use morphine in medical practice. Many substances that are abused have versions or forms of them that are used in medical practice. Now, we do have problems with the diversion of prescription drugs. It's become a growing problem that we're trying to educate and trying to help to prevent the harmful effects, but we do not believe that's by depriving people who have legitimate and these medicines can be a godsend to, of the medicines themselves. But the effort to look at, test, and make safe and efficacious substances that may be derivative from cannabis, may be derivative from other substances, some of which in other forms are street drugs or dangerous addictive substances, is the difference between medicine and drug abuse. We believe that there is a clear distinction here, and that distinction can be maintained, and it should be maintained for the benefit of all. But for those who then, instead of the science, instead of the process of review for safety and efficacy, say, no, we're going to run a bunch of ads where people testify that their mother dying smoked a joint and was saved, and that means that marijuana is medicine, would be laughable, except for the fact that it has had enormously detrimental effect on children's perception. Well, there have been surveys done. Many teens today believe that marijuana can cure cancer. And a whole variety of other maladies that advocates, and type into the web marijuana. Go to some of those sites, see what's claimed. Your children are being educated, but they're being told lies. And they're being told things that are designed to push a particular agenda which is detrimental to your children and detrimental to the country. With that, I'm going to close, and if there are other questions for individual panelists, we'll try to set those up. Thank you. Thank you all for coming. 21%. That is 1 in 5. When your child begins using marijuana at a younger age, which is what happens in the United States, it's not the days of the baby boomers of 18 and 19. It's 13, 12, 11, and 10. The risks go up dramatically as both the potency and the effect of this drug on younger brains is now better understood. We're trying to put that information in the hands of more parents and more young people. I want to thank the media for being here because you are the conveyors of information to the public. We are appreciative also of the media's cooperation in our campaign in the effort to allow us to get this information into the hands of more Americans. We'll now be happy to take questions. That it affects their risk of mental illness, their risk of addiction. Again, we are seeing larger numbers of teens who are seeking treatment for marijuana in the United States than for all other illegal drugs combined. It's corresponded with, over the last 10 years, a doubling of potency, but also, more importantly, the recognize, don't wait till your child gets a driver's license to be worried about them using marijuana. The age of first use is below the age of 16 in the United States. In many communities that I visit, where communities are working, it's down below teens. It's 12, 11, and 10. That's a message we have to reverse, that it's safe, and it's a message about vigilance we need to convey to more people who work with young people.
Dr. Walsh,
Years of research have helped to alert us to that use of marijuana in particular is a very dangerous risk for the mental health of our young people. You have in your press packet a recent summary of some of the research on use and mental health problems in the United States. Let me point to just one set of numbers in that package. The base rate of mental illness, serious mental illness estimated in the country of those citizens above 18 is a little over between 8 and 9%. For those who have used marijuana in their life, that increases to 12.5%. And for those who have used marijuana prior to age 12, the rate of mental illness jumps to 20 media for young people, but also for us to convey this to teachers and parents and urge them to sit down and focus on conveying this information. Because yes, the view of people who are healthy and energetic and lively is, I'm not at risk. And that's why they get in a car when they're high. That's why they get in a car with a driver who is high. That's why they get themselves into trouble and don't realize it until it's too late in many cases. And that's why in this case, also society is telling them in this case, unlike heroin or methamphetamine or cocaine, that marijuana is not a serious risk. That is deadly. And it is compromising not only the young people who may be involved in accidents, but now we see increasingly...
We've covered these steroid hearings up on the Hill, too, where it's making its way down to the high school and junior high level for kids hoping to improve their body tone or whatever. They don't feel vulnerable to this stuff, even when you hit them square in the head with it being dangerous. How can you hope to do that with today's message?
Well, I think we have to educate young people. Again, they're young, they're healthy, and so they don't think about their susceptibility to illness and to other problems that these risks involve. Our job as adults is to convey that to them. Young people are not born educated. Civilization depends on passing knowledge from one generation to the other. And I think what we're seeing is the hearings themselves, the efforts by the news media to write articles, not only for adult publications, but to make these available in the wider